Okay.
Hi there, this is Monica Stone and Jeremy Luther, and we are going to be presenting on the normal swallow. We're going to do it in two different stages. First, we're going to talk about how we would describe it to an adult patient that's maybe not necessarily going to know the medical terminology, so we're going to put it into layman's terms. And then we're going to follow that by a version that we could give to a medical colleague that maybe is not as familiar with the process of deglutition. So, all right, we're going to take it away. We're going to alternate between the different stages. There are four stages, so I will start off with the adult version, stage one. Hi there. So I'm going to tell you a little bit more about how swallowing works. It's a pretty complex system, but we do it without even thinking about it, and we do it hundreds and hundreds of times a day. So the first stage of swallowing is going to be called the oral preparatory stage. We're just going to get the food ready. So you might drink something or take a bite of something, and then your lip muscles are going to keep that food inside, and then your cheek muscles are going to hold it in place, and your tongue's going to hold that food up to the top of your mouth while your teeth are chewing it and chewing that bolus. So at this point, the back of your throat, there's a little bit, that little dangly bit, that's called the velum. Well, that's kind of up and high so that the food doesn't go into the back of your throat. So this is pretty much primarily just the chewing stage, that stage one. All right, go ahead and take it away, Jeremy.
Okay. So for our second stage, which is the oral transit stage, this is when your food is already chewed, or your liquid's already in your mouth, and your mouth is going to start to push it all back from the front to the back. It's going to push all the food back to your pharynx or like to the back of your throat. And then from there, we have our third phase, Monica.
Yeah, so the third phase is all about protecting our airway. We want to make sure that we don't get any food into our windpipe. So if you've ever swallowed and you said, "Oh, I think it went down the wrong pipe," it probably did. So this is a reflexive stage. So at this point, we can't stop the swallow. It's going to happen when the food hits the back of our mouth, the back of our throat. So at that point, what happens is we have a little bone in our throat and it comes up, and then our throat kind of shortens a little bit, and there's a flap of skin called the epiglottis, and it closes over our airway, nice and neat, so that we don't get any food particles or liquid into our airway. We have our vocal folds. We sometimes we call it our voice box, and we want that to close, and we want the epiglottis to close over it, so that our food gets pushed into our esophagus, our throat, where it's going to actually go down. And then there's some waves that are going to propel that food down, down, down towards the esophagus. And there's going to be a reflex that's going to open up what's called your sphincter, your esophageal sphincter. So basically, your food's going to that's going to open up, and your food's going to go down into that sphincter to go into the second stage, the second portion into your esophagus, where it's going to travel towards your stomach. All right, Jeremy, final stage. Let's take it away.
All right. And then when that food enters the esophagus, right at the top, that is now the esophageal stage. And pretty much that same wave of muscles is still continuously pushing your food down, your food or liquid down your esophagus. And then it will go all the way down to the lower esophagus, to the lower sphincter. And then from there, as long as there's no complications, the food or the liquid will be sent into your stomach. And that's it for swallowing. It's in a sense simple, but it's extremely complicated. And these are things that we do, like my friend Monica said, we do them a few hundred times a day, a lot of times without even thinking about it. And then now we will get into the more complicated version, the way that we may explain to a medical professional or colleague. And then we will let Monica start with this.
Excellent. I want to make a correction for us. I believe that it's actually thousands of times a day, if I'm not mistaken. So I apologize if there was some confusion there, but I'll check back on that, and I'll get the details on that. But it's a lot. Okay, so we're gonna move on now to the medical version. Okay, so we would give this to a clinical colleague that's maybe not familiar. All right. So I'm going to talk to you a little bit about the process of swallowing. The medical term for it is deglutition, And there are four stages of this normal swallow. And I'm going to take away with the first stage is called the oral preparatory phase. This stage is voluntary. The first and second stages are voluntary, so we have some control over that. During this first stage, we're going to take a bite of or a drink of a bolus, a material that's going to be in our mouth that we're going to ingest. And during this oral preparatory stage, the orbicularis oris muscles of the lips and the buccinators, the muscles of the cheeks here, are going to hold that food in to make sure that it's sealed anteriorly, laterally, and superiorly by the hard palate. Okay, so during this phase, our masseter muscles are going innervated by the facial nerves, are going to be chewing the bolus and breaking that food down. It's also going to be mixed with saliva to form a nice cohesive bolus so that it's going to go down our throat smoothly. We want it to be lubricated. The muscles here are going to be the temporalis and the petragoids, and they're all innervated by the mandibular branch of the trigeminal nerve. And that lip closure is going to be from the facial nerve, the cranial nerve 7, and that hypoglossal nerve is going to take care of that tongue movement here while it's forming a cohesive bolus and being pushed towards the hard palate. All right, go ahead and take away stage 2, Jeremy.
Okay, once again, stage two is after the food is chewed. Okay, and then from here we're gonna start to move that food back from the front of our mouth to the back, so the anterior to the posterior. Our tongue's gonna use its extrinsic and intrinsic muscles to start to push it back. And then while doing this, it's going to push it back past our hard palate, which in this picture is right over here, if you can see my cursor. Um, and then once it starts going to the soft palate's going to rise. And it's going to rise with the help of the tensor and levator veli palatini muscles, and that's going to raise the soft palate to kind of close the nasal cavity, so that way you don't get any food or any part of the bolus that can go up, and instead it directs it towards the pharynx. Okay, and then that your tongue pushes the food back with your hypoglossal nerve. That's what's sending all the information to your tongue very rapidly. Um, and then that's pretty much it. And that takes us to our stage three.
Perfect. Thanks, Jeremy. Stage 3, we have the pharyngeal phase. This is an involuntary phase, and it is also reflexive or autonomic. This stage is triggered by that bolus touching the facial pillars at the posterior portion of the oral cavity. So during this, that's going to send that afferent signal to the cranial nerve 9, which is going to be stimulating in the brain stem here, this medulla oblongata area, particularly the nucleus tractus solitarius and the nucleus ambiguus, two different nuclei in the brainstem that are very crucial to sending afferent and efferent signals while we're during the swallowing phase. So this phase is going to be really quick. It's going to happen fast, and it's very highly coordinated, but it's crucial for protecting the airway. So during this stage, that bolus is going to touch those facial pillars, and the bolus is going to go into the oropharynx. Pardon me, excuse me, the oropharynx. Okay, so it's going to go into the pharynx, and what's going to happen is our hyoid bone, which is located anteriorly here on our in our throat, is going to do what's called um, hylaryngeal excursion, pardon me. And so the hyoid bone is going to elevate, the larynx is going to elevate. It's going to come um, anteriorly and superiorly, and it's going to pull with it the epiglottis. And what the epiglottis is going to do is it's going to close over the larynx. So we're going to have a few different ways that we're going to protect our airway during this pharyngeal stage. One, we're going to have true vocal fold adduction. So the vocal folds are going to close over the glottis. So that glottis is going to close, not close over the glottis, but the glottis is going to close. So we will not have anything that's going to be able to penetrate that. But then our second layer of defense is going to be that epiglottis closing over that larynx. During this stage, the pharynx is going to shorten and tighten, and what's going to happen is we're going to get that velo pharyngeal. That's a toughie. That's a lot of syllables there. Velopharyngeal closure. The soft palate's going to elevate via the levator veli palatini, and the tensor veli palatini during with innervation from the vagus nerve, cranial nerve 10. And then we get that laryngeal elevation via the suprahyoid muscles. That's going to include the digastric, the mylohyoid, the geniohyaloid, and those are going to also be innervated by the trigeminal and the glossopharyngeal and that C1 nerve as well, a spinal nerve. Once we have that epiglottic closure, what's going to happen is the bolus is going to be in the pharynx. It's shortened, but now we're going to get some what we call peristaltic waves, or that Jeremy, can you help me out here? What was the name of pharyngeal striping? The striping wave is what they call it. And the pharyngeal contraction is going to start happening. It's going to be squeezing that bolus down. That's going to happen by the superior, the middle, and the inferior pharyngeal constrictors, innervated by the vagus nerve. And we're going to get that. Bolus moving downwards. What's going to happen is also that upper esophageal sphincter. We typically call it the UES. It's just to shorten it while we're talking to colleagues. That UES, the upper esophageal sphincter, is going to relax. It's typically constricted, but at this point we need that to open. So it's kind of a domino effect. The cricopharyngeus muscle is going to relax via the innervation from the cranial nerve 10, the vagus nerve, and it's going to open that sphincter so that our bolus can go into the esophagus. And so this is going to be that anterior to superior movement of the larynx, moving forward, mechanically opening the UES and allowing that bolus to enter the final stage of the swallow.
Okay,
All right.
and that final stage is where I come in back with the esophageal stage. And then once that food does enter the upper esophageal sphincter, the UES, is controlled by a parasympathetic innervation of the vagus nerve. So the vagus nerve is very big on this stage. Um, And so that the those same waves that started in stage three of the peristalsis and all of the constrictors, those same constrictions continuously go down the esophagus um, until it gets to the LES, which is the lower esophageal sphincter.
That's right.
And from here, as it continuously goes down, all the lower parts of the esophagus will start to relax, so that way the bolus can eat more easily go down. And when this happens, in certain cases, depending on how the bolus is formed or the size of the bolus, sometimes it can get stuck. And then when it does get stuck, your body has this opportunity to start a second peristalsis, separate from the first one. And then this can actually help further push that bolus down, and it'll go into the stomach once it is released. Then that lower esophageal sphincter will now close up to prevent any reflux from going. These are the stages of our swallowing, and each swallow, all of these parts kind of come together very quickly, and we don't really notice it on a day-to-day basis, but it is really something that is very magical, and kind of like a miracle, is how I see it. And it's something that we do many, many, many times a day. Thank you all for sitting here and watching our video. Um, thank you.
All right, thank you so much. And hey, Jeremy, I just wanted to say I appreciate you mentioning that LES, that lower esophageal sphincter, is going to close so that we don't have any reflux. I should have mentioned that as well in the pharyngeal stage. When that UES opens and allows that bolus to go in, it does close up again so that we don't get that reflux as well. So thanks for mentioning that. I hope you guys learned something that you can take with you to talk to your patients about. So this has been informative and fun. So thanks so much, everybody. Have a great day.